This patient is in your clinic today, seborrheic areas, crusts, scales, but zero blisters. If you miss this, you miss Pemphigus foliaceus. Let's see the patient. She is a 32-year-old patient who presents with a gradually progressive skin disorder of several months' duration. The disease began insidiously with scattered scaly lesions over the scalp, face, upper chest, and upper back. On examination, there are well-demarcated crusted erosions surrounded by erythema, predominantly over seborrheic areas. Obvious bullae are absent, but some lesions show a fine collerette of superficial scale. The skin appears fragile, and in advanced areas there are oozing, crusted erosions, with occasional small vesicles at the margins. Mucosal surfaces are spared. A skin biopsy is performed. Histopathology shows superficial acantholysis just below the stratum corneum, with detached keratinocytes in the blister cavity and a mild inflammatory infiltrate. Direct immunofluorescence reveals intercellular IgG in the upper epidermis. So, what is the answer? Yes, you are right. The answer is definitely Pemphigus foliaceus. No bullae, no mucosa, superficial scales. Clinically, Pemphigus foliaceus can be tricky. It may resemble seborrheic dermatitis, as both commonly affect seborrheic areas and spare the mucosa. Impetigo can also mimic Pemphigus foliaceus, since both involve desmoglein 1 mediated superficial blistering. Dermatitis herpetiformis is another mimic. Because of intense itching, patients scratch continuously, destroying intact vesicles early. Both conditions may appear as crusted, superficial erosions. Paraneoplastic pemphigus may resemble Pemphigus foliaceus early, due to superficial erosions. Chronic cutaneous graft versus host disease can also look similar, with superficial erosions and scaly plaques. However, it occurs after transplantation and shows interface dermatitis rather than acantholysis. Chronic cutaneous lupus may mimic Pemphigus foliaceus as well, presenting with superficial erosions and crusted plaques on the face and scalp. Some viral infections, such as herpes simplex, can also resemble Pemphigus foliaceus. Superficial vesicles rupture rapidly, forming crusted erosions. Clues like grouping, pain, systemic symptoms, and characteristic distribution help differentiate them. Lichen planus may also resemble Pemphigus foliaceus. Erythema multiforme can mimic it too, when vesicles rupture and leave superficial erosions and crusts. However, classic target lesions, mucosal involvement, and a post-infectious history help distinguish it. Pemphigus erythematosus is a localized variant of Pemphigus foliaceus, sharing the same subcorneal acantholysis. It can be considered in the differential, especially when lesions are limited to the face and sun-exposed areas. Ultimately, each of these conditions has its own specific clinical features and diagnostic investigations. That is why histology and immunofluorescence are key. They separate the mimics from the real deal, Pemphigus foliaceus. If you like this video, please like, comment, share, and subscribe. Thank you for watching.